Sennosides are commonly used to relieve constipation and may also be used to clear out the intestines before a bowel examination or surgery. They are known as stimulant laxatives and work by helping to retain water in the intestines, which stimulates movement. It is important to follow the recommended dosage for Ex-Lax and take it with a full glass of water. It is best to take Ex-Lax at bedtime or as directed by a healthcare professional. Remember to never exceed the recommended dosage and consult a doctor if you have any concerns. When taking Ex-Lax, be sure to follow the directions given by your doctor or on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. If you're using the chewable tablets, chew each one well before swallowing. If you're using the dissolving strips, let them dissolve on your tongue and then swallow with or without water. When using the liquid form, be sure to measure the dose carefully with a special measuring device, and avoid using a household spoon. The dosage of Ex-Lax will depend on your age, medical condition, and how you respond to the treatment. It's important not to take more than directed or use it for more than 7 days unless instructed by your doctor. Overuse of this medication can lead to serious side effects, so it's essential to follow the recommended dosage. It typically takes 6 to 12 hours for Ex-Lax to cause a bowel movement. If your condition doesn't improve or if you experience rectal bleeding, it's important to inform your doctor. And if you suspect a serious medical issue, seek medical help immediately. If you experience stomach pain, cramping, nausea, diarrhea, or weakness, make sure to tell your doctor or pharmacist. This medication may also cause your urine to turn reddish-brown, but this is harmless and will go away when you stop taking the medication. Remember that your doctor has determined that the benefits of taking this medication outweigh the potential side effects. However, if you experience any serious side effects such as persistent nausea, vomiting, diarrhea, muscle cramps, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood, be sure to contact your doctor right away. While it's rare, a serious allergic reaction to this drug can occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, be sure to speak to your doctor or pharmacist. Before taking Ex-Lax, make sure to inform your doctor or pharmacist of any allergies you may have, especially to senna. It's important to discuss any inactive ingredients in the product that may cause allergic reactions or other issues. If you have a history of appendicitis, sudden changes in bowel habits lasting longer than 2 weeks, bleeding from the rectum, or intestinal blockage, it's crucial to inform your doctor or pharmacist before using this medication. Additionally, if you are planning to have surgery, it's important to disclose all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For those using chewable tablets or dissolving strips, be aware that they may contain sugar. If you have diabetes or need to limit/avoid sugar in your diet, consult your doctor or pharmacist before using this product. If you are pregnant, it's not recommended to use Ex-Lax for long periods. Consult your doctor for more details. This medication can pass into breast milk, but it's unlikely to harm a nursing infant. As always, consult your doctor before breastfeeding while using this medication. When taking Ex-Lax, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's a good idea to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. This will help them to determine if there are any potential interactions with Ex-Lax. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines while taking Ex-Lax. It's important to follow their guidance to ensure your safety and well-being. As always, it's best to consult with a healthcare professional for personalized advice. If someone has taken too much Ex-Lax and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an Ex-Lax overdose may include ongoing nausea, vomiting, or diarrhea, as well as severe stomach or abdominal pain. It's important to seek medical attention if any of these symptoms occur. Make sure to keep all your medical and lab appointments. If you're dealing with constipation, there are some lifestyle changes that can help. Try to exercise regularly, stay hydrated by drinking enough water, and eat a balanced diet with plenty of fiber-rich foods like bran, fresh fruits, and vegetables. If you're looking for more tips on how to relieve constipation, be sure to talk to your doctor or pharmacist to see what might work best for you. If you are taking Ex-Lax on a regular schedule and you happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, then you should just skip the missed dose and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. Just take your next dose at the usual time. When it comes to storing Ex-Lax, it's important to check the product package for specific instructions on how to store it. It's also crucial to keep all medications out of reach of children and pets. When it comes to getting rid of expired or unused Ex-Lax, it's best to consult your pharmacist or local waste disposal company for proper disposal methods. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.